Hello, I'm Dr. John Cruz, and today I'm going to be talking about... Hello, I'm Dr. John Cruz, and today I'm going to be talking about drug holidays and whether they work or not, or help or not for people with ADHD. So I'll start with the take-home, and that is, except for with respect to a very narrow question as to whether taking a break from stimulants helps with growth in children taking these medications, and there is evidence that that's helpful. This is an area, even though the recommendation for breaks is a standard one, we have extremely little data, I would argue no studies formally looking at the long-term consequences of taking drug holidays versus not taking drug holidays. So, to jump into it. For decades, the standard recommendation for children, particularly middle and upper class children in America, on stimulant medications has been that the children should take a break from the medication during holidays, and often the recommendation is also weekends and holidays. So 2 days off every week for the weekend, and potentially periods of months off during summer, or a few weeks off during Christmas time, holiday time. I'm aware many people don't celebrate Christmas, but sorry. So although that's been the standard recommendation for years, and my impression is that that recommendation has become a little less prevalent as more and more children are engaged in weekend summer activities, which are considered important for future success or getting into future high schools or colleges, so that they're doing soccer practice 6 times a week, they're practicing violin, they're engaging in other activities which require clearly sustained focus and attention. My experience is that that recommendation seems to be waning somewhat, but it's still there. But whether that, again, I'm jumping ahead, but we have very little data as to whether that's actually helpful or not. Why it might be helpful, why it sounds reasonable to recommend a drug holiday are 3 main reasons. And the first reason I'd say is compelling, certainly for every child and probably for most adults with ADHD. So the first reason is to assess whether the medication is really doing anything or whether it's still needed. Why that's critically important for kids is we do know that maybe a third of kids largely outgrow their ADHD. So, and currently we don't have markers for which kids are going to outgrow it. So if you're just taking medications indefinitely, it's hard, without any break, without any check, it's hard to know, does this kid still really need it or not? Now in adults, I would argue that the data, the studies, in my own clinical experience, pretty overwhelmingly suggest once you're in early adulthood, your ADHD is likely to continue at some substantial level. There may be fluctuations in intensity of ADD symptoms. My observation is that most of that fluctuation is due to either change in demands or change in available structure, and the mismatch between demands and structure. But even for adults, it's probably reasonable to see whether the medication is still apparently doing something. And I'd say particularly for adults, and this goes for another reason backing up that you need to do an assessment, is often diagnosis is made within a very, almost immediately after or even at the time of diagnosis of ADHD, the person starts learning about ADHD, so there's a whole educational component thrown in. They may start cognitive behavioral approaches or other therapy, talking therapy approaches to help with ADHD, and they may start with medication at close to the same time. And often the ongoing assumption is, oh, it's the medication that's helping. But again, in this case, it's often useful to have a pause in the medication to check. Maybe it really is these structural behavioral changes in the person's life they instituted. Maybe it's just their awareness of ADHD and how they've changed how they communicate with others or to get them to help or understand what's going on better. So one, I think, valid reason for drug holidays is to reassess the adequacy and efficacy of medications. Number 2 point, and this is widely suggested, that a reason for a drug holiday is to reduce tolerance to the medication. So if you're taking a break, maybe receptors won't be downgraded, maybe proteins that are involved in the process will be, how much is being manufactured by your body will be reset or recalibrated. How common tolerance is itself in ADHD, and I've talked on this in some of the other talks, is we don't have good data. So my observation is that across the ADD field, it's really common. Most lectures I've attended, most experts I've heard talking about it will say something like, yes, it often takes a few weeks or maybe even a few months after you start medication to sort out what dose is effective. But once you figure out what's an effective dose, that dose tends to be effective and continues to work over time. They won't deny that some people develop tolerance, but they classify it as a rare or uncommon outcome. On the other hand, if you talk to the addiction experts, they will say, oh, stimulants, everyone develops tolerance. Everyone is going to need more of a higher dose over time to get the same effect. There's a marked discrepancy between the two fields, looking at supposedly the same medications and potentially, maybe some of the differences, different groups of people. My own sense in my own practice, and I actually went back and collected data a year or two ago, so I went through my records and stopped after I got to 100 patients. So my criteria were people had to have been on a stable dose for at least a year, and then I looked at whether they were on that same dose a year later. And what I found was that more than 80% of individuals were on the exact same dose they were a year previously, and roughly equal groups actually went up in dose versus down in dose. Now, some of this was conducted during COVID, when a time of heightened anxiety worldwide and also changes in structure for most people's environment. And those changes, either increased structure and increased anxiety, may well have been part of why, of those who didn't stay on the same dose, at least as many were lowering the dose as increasing the dose. I won't pretend my population of people is representative of all adults with ADHD, and I won't pretend that my own biases or expectations may not have led patients to followed what I expect them to do. But I think in the real world, my observation again is tolerance is not a huge ongoing issue for most people with ADHD. So taking breaks to prevent tolerance. One, again, we have absolutely no data that I've been able to find to show that that's really true. And you could actually even argue that taking breaks may not reduce tolerance, but may increase tolerance. That toggling back and forth, on and off, could itself have effects on the system to make someone less sensitive to drug exposure. So, third reason, and this is to me the most interesting topic because we don't know exactly what's going on, is the rationale for taking drug holidays would be to reduce adverse effects. And I break those into immediate short-term effects versus chronic effects. So there are certainly some people who have appetite suppression, who have insomnia, who have anxiety or other side effects from medications. There's a little bit of evidence that taking a break is likely to help reduce the problems of appetite suppression, help problems with insomnia, and particularly neither of those things are patterns that you want to develop in the long run or worsen. The bigger question as to whether drug holidays disrupt chronic or long-term effects has been most extensively studied in height changes, growth changes, and I'll get to those after I'm finished reviewing reasons for and against drug holidays. And to me, the bigger issue maybe for adults, where clearly the height issue is not, adults have stopped growing height-wise. So to me, the big issues in the population I deal with primarily is your risk for addiction higher or lower if you take drug holidays, and or is the risk for amphetamine-induced psychosis higher or lower from drug holidays? And again, I've said very little data. So what are the reasons against taking drug holidays? And I would put those in four main categories. One is taking a drug holiday can destabilize or cause a deterioration of someone's condition. ADHD clearly exists on the spectrum. I've dealt with a number of people on the severe end of the spectrum, and I have seen situations where just missing medication for a few days had catastrophic impact. I've seen people lose their housing because they couldn't get it together to get their payments in on time. I've seen people whose cars have been towed because they couldn't manage to move their car on the public streets so that they got ticket or towed. I've seen people lose their jobs because of outbursts or other behavior from very brief lapses in taking their medication. So although many adults and many children aren't going to be that severely impacted from a brief stay or stop in medication, some people will be. Just again, ADHD is not just a trivial condition. This is what I would call a serious mental condition in many individuals. Second main reason for against taking breaks, and this isn't as much as a reason not to take them, it's a reason to be cautious about interpreting the results of what you're seeing from drug holidays, is potential confusion between what are called withdrawal or rebound symptoms versus what the effects of discontinuation are. And this may be a little easier for me to explain comparing this to serotonin reuptake inhibitors for depression. So again, I'm jumping categories of drugs here and conditions we're treating it, but a fair number of people, let's say almost half of people, will have withdrawal effects when they stop, or even just a day or two, their Paxil, their Zoloft, their Lexapro. And those withdrawal symptoms are often physical symptoms that look like, that are nausea, headaches, muscle aches, malaise. They can also be readily crying. They can also be more volatile moods. And it's easy, particularly some of those in the last cluster, to confuse that as, oh, that's a sign depression's returning. On the other hand, what we know from a range of studies is that interrupting treatment for a day or two is extremely unlikely to trigger depression. Again, almost always what we're seeing is a withdrawal effect, and you need to be off those medications for days, for not just a few days, but for many days, several weeks, to determine whether it's really stopped helping with depression or whether it's really needed for depression. So again, the point is, if you see some phenomena after you've stopped for a few days, it's hard to know whether that's a system rebounding or where that's really revealing where the person would be without any medication at all. Third reason for not having drug holidays is the potential for increasing poor adherence to medication. Excuse me. So we know that one person's definition of ADHD is actually someone who's consistently inconsistent. So establishing regular patterns, taking their medications regularly, is a challenge for many people with ADHD. Usually we want to encourage regular dosing of their medications. And if you're telling people, oh, take it Monday, Tuesday through Friday, but you don't need to take it Saturday and Sunday, we're inherently building in inconsistency, disrupting patterns, loosening associations. So if we're telling someone, oh, as soon as you get out of bed, or oh, when you're checking your email in the morning, that's a good cue to taking your medications. And now we're telling them, oh, except these days you don't have to do it. We are almost certainly increasing poorer adherence or less regular taking of medication in a subset of people with ADHD. Moving on to the fourth objection. So the fourth objection to drug holidays is that ADHD isn't just an academic or vocational issue. It's not just a cognitive, attention focus problem. It affects emotion regulation, it affects communication, it affects a range of executive functions. And as one person has said, if the medications help you be your best self, why wouldn't you want to be your best self on the weekends when you're enjoying time with friends or doing tasks or hobbies that are important to you? So that would be a fourth reason against drug holidays. So again, what's the evidence we have? So the best evidence we have for a benefit from drug holidays is with growth patterns in children. We've known for 50 plus years that regular use of stimulants do impair height, achieving expected heights for kids with ADHD. We know that the earlier treatment is started with medications and the longer it goes without interruption, the greater that deviation in height, the shorter the person is compared to what we would expect them to grow up to be. And at least a few studies have looked at, weekend holidays don't seem sufficient for allowing normal growth, but more extensive holidays, so not taking it during the summertime, does seem to allow fairly close to normal expectations for growth. I'll sort of just add as an aside, even though height seems to be impaired by the stimulants, evidence from the last 20 years is that children with ADHD, whether they are on medications or not, actually tend to be heavier for their height, so higher BMI, body mass index. That's widely attributed to the availability of high caloric food, the easy accessibility to it, and that ADHD seems to be associated with poor impulse control, probably poor interoceptive feedback as to what your body's doing, probably more distracted eating, so kids are eating while they're watching video games. But again, the growth issue is mostly directed at height rather than weight. So there are a handful of studies that have looked at what happens or how people do when they're taking a break. And I would say that these studies are looking at breaks rather than holidays, because to me, drug holidays implies that there will be a habitual pattern, again, either every summer or when you have a few weeks off from school, or every weekend, if that's when you're doing it. So there are a few studies that have looked at, after someone takes a break for a few days, how are they functioning, how are side effects abated or not. So again, breaks do seem to have a beneficial effect for reducing the likelihood of ongoing insomnia, reducing the likelihood of ongoing appetite suppression. So those, again, are acute short-term effects. There's only one study that I found that actually looked in a controlled way, and it only had 40 people in the study and only looked for 4 weeks. They compared a group taking it every day that month versus 5 days on, 2 days off. So either the handful of break studies or this one drug holiday study have not found major differences in terms of overall level of functioning, overall benefits from medication, overall ADD symptomatology from taking holidays versus not. Certainly a number of patients I've worked with feel that they are more aware of the effects of the medication on Mondays if they've taken a break over the holidays, or do feel that the effects are more robust on Mondays, whether that's due to placebo effects, whether it's a real physiologic effect, whether it's due to just the contrast between being off of it for a few days and on it and being more aware of what the medication's doing, whether it's effects on Monday being more challenging or harder to transition to from the weekend. I would say that question is up in the air. And to me, the far more substantial question is to whether there will be a long-term impact on reducing rates of addiction or reducing rates of amphetamine-induced psychosis from drugged holidays. I have not been able to find any data whatsoever. It's interesting, when I looked up drug holidays and stimulants, there are actually substantially more articles on what kind of illicit drugs people take when they're on their breaks or taking a holiday than there were studies looking at explicit what is taking a break from your prescription medications going to yield. So next week I won't be talking here. 2 weeks from now I think I'm going to be talking on dopamine norepinephrine differences. I'll end with a little clip, if I can, from Madonna telling you to celebrate your holidays. So that's all. Bye for now.